Affairs Committee. Today is Tuesday, April 6th, and we are live streaming today's hearings. Most of these are local bills. We expect them to go fairly quickly. And after the sponsor or representatives gives their testimony, we will take any testimony from a lead witness up to 5 minutes and any other proponents up to 2.5 minutes. I think in many cases that may not even happen. I'm going to remind you that we love to see your smiling faces while you're testifying, and we appreciate if your full name is there so we know who we're listening to and learning from. Please make sure that when you are not speaking, when you're not testifying, please make sure that you are muted. And we also ask in EHE, Education, Health, and Environmental Affairs, that you try to avoid acronyms so that everybody knows what you're talking about, since you are trying to be persuasive. So with that, Delegate Hamprey, we are giving you the courtesy of being first as you requested. So welcome to the newest delegate. We'll be kicking us off with House Bill 915, Work Group on Black, Latino, Asian American, Pacific Islander, and other underrepresented behavioral health professionals. You will start with your testimony, followed by Denise Antoine and Council Member Zeke Cohen, if he is in the room, will follow that. Welcome to your first Senate hearing, Delegate Hamprey. You may begin.
Thank you so much, Madam Chair and members of the committee. Thank you so much for your time today. For the record, Delegate Marlon Hamprey here in support of House Bill 915. House Bill 915 is being introduced for the purpose of studying the shortage of Black, Latino, Asian American, and Pacific Islander API community and those otherwise underrepresented groups in the mental and behavioral health professions here in Maryland, in order to eventually make recommendations on incentives and systematic changes and/or other methods to increase the amount of providers from these groups. We know that currently in this nation and in the state, we have a general shortage of behavioral health or mental health providers as a whole. But when it comes to communities of color that are detailed in this bill, there's even a higher need. And there is extreme gaps in the amount of providers that look like our community here in Maryland. This bill is extremely important in ensuring that our diverse population has access to an equally diverse pool of providers. And there's abundance of research supporting that the measures to ensure that there's diversity within the behavioral mental health field ensures that there will be the best type of care provided to those individuals that make up that actual group. So some of the numbers I can give you really quick before I detail what the bill actually does. Just to give you a background on some of the discrepancies and how they affect certain communities, ethnic and racial minorities often bear a disproportionately high burden of disability resulting from mental disorders. For example, although rates of depression are lower in Blacks at 24.6% and Latino at 19.6%, depression in Blacks and Latino communities are likely to be more persistent, and Blacks are 20% more likely to experience serious mental health problems than the general population. And these numbers clearly indicate that while there isn't any biological or any other reasoning as to why these groups have higher rates of certain instances, it more so points to the lack of access to care to providers. And we know that the data shows that that whenever people are able to be given mental and behavioral health provision by someone that is from their race or their culture or their ethnicity, there's higher rates of success as far as the ability for that person to actually come back, for them to be able to connect with that person in a way that is real and authentic, and for that they can really understand some of the issues that they might face. People from racial and ethnic minority groups are more likely to experience racism, which the American Psychological Association identified as a form of trauma. This can lead to PTSD and other psychological issues, which are unique lived experience of people from minority groups that are best understood by providers from the same background. Data from the Johns Hopkins shows that with psychiatry, historically underrepresented minorities in medicine had less representation as residents at 16.2%, faculty 8.7%, and practicing physicians only at 10.4%. Compared with the U.S. population at 32.6%. So we have huge gaps in the makeup of these providers. And only 2% of all practicing psychiatrists identify as Black, which is a huge gap that we need to address. So I think that we see all the numbers here, and the lack of cultural understanding by health providers may contribute to underdiagnosis and or misdiagnosis of mental illness in people from ethnically diverse populations. Factors that contribute to these kinds of misdiagnoses include language differences between patient and provider, stigma of mental illnesses among minority groups, and cultural presentation of symptoms. And I can go on and on with other data points to really showcase why we need more providers of color in order to connect with other communities of color. But I can also speak to my own experiences. Before I was an attorney, I was a teacher and I worked with students. And I could really see that those students that had certain disorders and they needed assistance, when we were able to bring in providers that looked like them, that came from the same kind of communities and neighborhoods that they came from, I could see a drastic difference in the ability that my student was able to connect with those people and really see major changes. And it really, not only did it change the student's life, it also encouraged members from some of those students' families to consider seeking out behavioral health services. So it can really be a cultural shift that we can do here. And what this bill will actually do is put together a work study group comprised of members from the HBC community, members from health providers, as far as our hospital networks that provide services to majority communities of color. It will work with even within this will be a subgroup of insurance providers, and there also will be a group of individuals that make up institutions that are already working towards diversifying the behavioral health field. And what this work group will work to do is, as I said at the very beginning, we're figuring out ways in which we can diversify it through incentives, systematic changes, and other methods to increase the amount of people going to school to study these fields, to increase the amount of people that are deciding to go and serve into the communities that need the most assistance and help. And also even find ways in which we can get individuals from even outside of the state of Maryland to consider why they would want to come and provide services here in Maryland. And we really need this. We got overwhelming support here in the House, and it was voted out. And also we have an overwhelming support of institutions and providers who really believe in this. And I really think that we are on the precipice of there being some really systematic changes within how we address behavioral health. And there's movements as far as here in Baltimore, we have the trauma-informed care that we're doing. And there's just so many ways in which we can really infiltrate and do some amazing things. And we need to make sure that we have healthcare providers that look like the members of the communities that they're serving. So I asked for a favorable report, and I hope that you can listen to some of the people who were speaking on behalf today. And unfortunately, I don't believe that Councilman Cohen will be able to speak, but I ask that you all take the time to review the testimony from the House, the hearing in the House. Thank you so much.
Thank you, Delegate Hamprey. I was looking for Councilmember Cohen, so I'm sorry he's not with us, but you do have, is it Denise or Dennis? Antoine?
Dennis Antoine.
Hey, Mr. Antoine, thank you for being with us. You may begin your testimony.
Thank you so much. Thank you, Chair Pinsky and members of the committee. I want to thank the bill's sponsor, Delegate Hamprey, to testify on this, for the opportunity to testify on this important issue. My name is Dr. Dennis Antoine, and Johns Hopkins is pleased to support this Bill 915. Diversity and inclusion is a core value of Johns Hopkins medicine. As an institution, it remains dedicated and committed to reducing health disparities that are present throughout the state of Maryland. Health disparities, unfortunately, have been a long-standing systemic problem in the Black, Hispanic, and Indigenous communities. The COVID-19 pandemic has only further exacerbated these disparities and has heightened the need for this and other legislation aimed at reducing this blight in our communities. Unfortunately, disparities are quite common in mental health. Strategies to improve healthcare would likewise improve mental health disparities, included but not limited to access to care and quality of care. Analogous to healthcare in general, diversifying a mental health workforce is an important step to eliminating mental health disparities as well. Research has shown that disparities in healthcare exist in access and use. Efforts to eliminate these disparities have not been successful in primary care or specialty psychiatric services. An important contributor to health and healthcare disparities is the lack of a diverse biomedical workforce that reflects the racial and ethnic diversity of the communities served by medical establishments. As Delegate Hamprey noted, according to the American Association of Medical Colleges, only 2% of practicing psychiatrists in the United States are Black or African American. And beyond medical training, the literature demonstrates that cultural incompetence of healthcare providers likely contributes to underdiagnosis and or misdiagnosis of mental health issues in these communities. language differences between patient and provider, stigma of mental health illness, and cultural presentation of symptoms are some of the many barriers to care that explain these errors in the diagnostic process. As a result, these populations have comparable or slightly lower rates of good mental health treatment than compared to the white population, and often experience a disproportionately high burden of disability from mental health disorders. Therefore, in order to deliver high quality, culturally appropriate care, it is critical to increase diversity of not only the physician workforce, but also of all healthcare workforce practitioners. In conclusion, Johns Hopkins is pleased to support this Bill 915 and urges a favorable report. And thank you again for this opportunity, and I'm happy to answer any questions.
Thank you very much, Dr. Antoine, for your testimony. I see that Senator Washington has a question.
Thank you, Madam Chair. Thank you, Delegate Hamprey, for bringing this. I just have a question. This is a work group?
Yes, Senator.
I thought there weren't any work groups or task forces coming over. I think this is a good issue. I'm just curious that it's a work group. I also noticed that there are no members of the General Assembly on here. Typically, when we have work sessions, members, I know when I draft task force or work sessions, we usually have someone from the General Assembly who's reporting to that, or that the work group makes recommendations, and they make recommendations to specific committees. Are you opposed to any amendments that will sort of clarify who in the General Assembly would be getting the report, and also to add members of the General Assembly, because at the end of the day, we're the policymakers?
No, I would not be opposed to those type of amendments. I think I think that makes sense. So the goal here was just to ensure that we had experts in the field guiding the discussion.
Oh yeah.
I think what you bring forward does make sense.
And I'm assuming you would be interested in serving on that work group and perhaps chairing it or ensuring that the work is followed through.
Yeah, I mean, I would be happy to. But at the same time, if someone else has more experience within the actual medical field that has more, I just want to make sure that whatever comes out, whoever's overseeing is the most qualified. So
yeah, great. Okay, thank you, Madam Chair. Again, this is an important topic. Work groups are really important to make sure that we have an opportunity to study an issue with experts, and then we are then able to make good legislation. So I look forward to, some of the work group bills that we have going through, coming through as well. I support what you're doing here. Thank you. Thank you, Madam.
Thank you, Senator Washington. And Delegate Hamprey, Senator Washington makes an important point. And I know you're a new member of HGO, but Health and Government Operations. And Senator Lamb, I see your question. I just want to follow up with Senator Washington for 2 seconds. But we have heard that there is a new policy, and we're not sure what that is. And so if you have any guidance, because we think that reasonable work groups and task forces and commissions and all that should move forward to help advise us on policy. So if there's a secret key to the kingdom as to what flies and what doesn't in terms of work groups, that would be great. So we don't waste our time passing them over to you.
No, understood.
Okay, thank you. Senator Lamb.
Sure. So, and thank you to Delegate Hamprey for bringing this forward. I think I agree this is a really important issue. And I think Senator Washington already questioned when it came to having representation from the General Assembly on there. So I guess my question's for Dr. Antoine. It sounded like from your testimony, you were saying that only 2 or 3% of behavioral health providers are African-American. Is that statistic correct?
So that's in particular to psychiatrists.
Okay.
In this case, there is, I would say, a wider distribution. If you're looking into underrepresented practitioners across the spectrum of all types of practitioners, but again, we're not getting up to double digits at that point. I think we would still be between the 5 to 10% range if you're looking at the underrepresented spectrum.
Yeah. Well, thanks for bringing that to our attention. This is obviously a huge disparity when you have patients that are meeting with providers and the providers don't necessarily look like or have any ability to connect with their patients. So this is a really important issue. I assume then the work group, if this comes to fruition, will look at the education process of these folks, right? That if you want more underrepresented people in these professions, you do need to train them. And so I assume that's part of the purview of this too. Delegate Hamprey?
Yeah. We have spoken with our HBCUs here in the state of Maryland. They're on board, and the Department of Health actually has also submitted a letter where they have they're doing some of the similar work with Maryland's historically Black colleges, and they actually there's a letter from February 25th in which they say that this work group really will help support them in their work and figuring out how they can best support what they're doing at the collegiate level. And you know, we're excited that, you know, Morgan State's going to be having their med school here soon. So I think having this together and this information available to them would also be a great way for that to spearhead something in the future. But I think we definitely need to ensure that we have people going to school and studying. I mean, I had several conversations with friends and former colleagues who are in the field, and they talk about how, you know, when they're in these rooms and they see, you know, people who started the school, went to school to become a social worker or went to school to become some type of provider, by the end, it's only like one or two when it comes to, like, you know, African Americans in the class, right? So it's definitely a major component of this work group and figuring out ways to make sure that we have a great group of people coming up and through the channels. As
a physician, I'm glad to hear Morgan State is bringing another medical school to Maryland as well. So thank you. Back to you, Senator Kagan.
Thank you, Senator Lamb. I see no other questions, so that completes the hearing on House Bill 915. Thank you, Delegate Hamprey. Next up is Delegate Carr from the district right next door to mine. House Bill 272, Public Information Act, Required Denials, Sociological Information and Distribution Lists. Delegate Carr will be the only witness. And before I hand it off to him, I neglected to say that Chair Pinsky had another meeting, and that's why I'm kicking things off. But I believe that we can expect to see him again in a little bit. So Delegate Carr, welcome back to EHE.
Thank you, Madam Chair. Good afternoon, colleagues. For the record, Al Carr here to present House Bill 272 as the lead sponsor. This is a bill that closes two loopholes in the Maryland Public Information Act. In 2018, thanks to the good work of this committee and especially the work of the Vice Chair, the General Assembly passed a bill to protect our constituents. The Maryland Municipal League had this as a priority bill to protect distribution lists so that people wouldn't be at risk of having hundreds or thousands of their email addresses harvested and then used for an unintended purpose when they were just signing up for a newsletter or something like that. So unfortunately, the Maryland Department of Transportation has found a loophole in that law that they are using instead of to help municipalities to hurt municipalities. So you can see in your testimony, there's a letter of support from North Chevy Chase. They're a municipality in my district. And because of their location, they're right against I-495, the Capitol Beltway, and they're very, very interested in anything that happens to that road. In 2017, there was a proposal to widen I-495 with 4 additional private toll lanes. And this small municipality has been trying to work with MDOT and get information, and they've been a little frustrated at the lack of communication. So when their citizens began receiving letters in the mail, this is the first step of eminent domain, is that MDOT sends a letter to a property owner saying, we're considering acquiring your property. You might have workers on your property taking soil samples or surveying or putting down stakes. So after having very little communication from MDOT and their citizens receiving these letters directly, they were alarmed and they contacted their legislators. So working with them, we approached MDOT to say, can you tell us more about what's going on? Can you reveal the footprint of your project? Can you tell us who's receiving the letters, which properties did they go to? And MDOT denied that request, and they cited the 2018 law, and they said, letters like this are a distribution list, so we have to deny that request. So part number 1 of the bill closes that loophole, and it says that a letter like this sent by MDOT for eminent domain first step is not a distribution list. So when we reframed that request to get around the distribution list issue, MDOT came back with another denial using a different reason. They said, we can't share those letters with you because they are sociological information. So in the MPIA, sociological information is one of the required denials. However, it's not defined in the Act. Each agency is allowed to define that term for themselves. And MDOT quietly in 2014 put in COMAR a very broad definition of sociological information that's not really connected to what the original purpose was. So part number 2 of the bill says that a letter like this sent to a property owner for eminent domain by MDOT is not sociological information. So those are the 2 main pieces of the bill to shut down those 2 loopholes. So to be, as an extra safeguard, we also put language in the bill that says that if someone were to come to MDOT to request letters like these, they would have to sign something just stating that they're not using that information for commercial purposes. Now, the information in a letter like this, it's not HIPAA, it's not cyber, security. It's just information from the land records, which are public. Every property is in the land records. Every property has a property owner. It has a mailing address. It has an ID. That's the type of information in these letters. So it's not top secret, but to just as an extra safeguard, we put that in the bill too. It turned out for that particular project, there were about 3,700 properties that received these letters, not just in my district, but in other legislative districts as well. And I think MDOT's point in denying the request was not to protect property owners, but to just prevent the public from understanding the footprint of their project. So you'll also see a letter of support from the Maryland DC Press Association in your testimony. And the sad thing is MDOT didn't used to be this way in the past. I've been in the legislature for 13 years. I've requested information in the past and MDOT never hesitated to share it, but just in recent years, they've gotten much more creative in finding ways to shut down legitimate information requests. So this bill is the remedy for that problem. I respectfully ask for a favorable report and happy to answer any questions.
Thank you very much, Delegate Carr. Great issue, great bill, and just colleagues, for those of you who are around, all 47 senators co-sponsored that bill that we passed that Delegate Carr was referencing. I see that Senator Ellis has a question.
Yeah, thank you, Madam Vice Chair and Delegate Carr, great bill. So this bill just applies to MDOT and their records release?
Yes, thank you, Senator, for that question. So yeah, in the Real Properties article, it outlines the process for eminent domain by MDOT. So MDOT is required, if they want to acquire a property, they're required to send one of these letters, certified return receipt. So yes, so the bill only applies to MDOT because they're the only entity that would send a letter like this.
Okay, so if someone wants to, if the state wants to build a state office building on some land through General Services Department, and they could go for eminent domain also, right? And so they would use a different type of letter. And so this bill wouldn't apply to that situation?
Yeah, I think this provision in the Real Properties article is specific to MDOT. And I know that in COMAR, the definition of sociological information is specific to MDOT. So this bill is really narrowly tailored to address MDOT's creative use of loopholes.
Okay, great. Well, thank you for that.
Thank you, Senator Ellis. I see no other colleagues with questions. I have a quick question for you, Delegate Carr. It has on page 3, lines 8 through 10, a custodian shall allow the inspection of a notice or a list of the recipients of a notice, blah, 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 if you ask for it in writing and promise that you're not going to solicit out of it. So can you please clarify what that means, inspection? Does that mean I can literally just go and look at it? Does it mean I can get a copy? What does that mean? Am I going to be able to use it for non-commercial solicitation purposes?
Right. So my understanding of that is, if you want to see it, which means you can get a copy of it. If you want to see it or get a copy of it, you would just, this was taken from election law. Like if I'm a candidate for office, I can get the voter database from the Board of Elections, but I have to sign something saying what I'm going to use it for. This would be very similar, just to say, if I want to go to MDOT and get, letters like these or a list of letters like these, I just have to sign something saying, I'm not going to use this to market or, use it for commercial purposes to sell it to these people or to, something like that.
So I see that the House passed it unanimously, which doesn't happen terribly often. Congratulations on that. Maybe Council, Ms. Morton, if we can just make sure that inspection is as clear as we need it to be for this, that would be great. And that's the end of my question. I see no other questions, in which case the hearing for House Bill 272 is complete, and I hand the chair back to the chair.
Thank you, Madam Vice Chair. We're going to proceed with HB 444. Hopefully Delegate Walker is with us. Yes, he is. This is Prince George's County Planning Board Non-Traditional Recreational Opportunities. Delegate Walker, welcome to EHE.
Thank you. Good to see so many of my friends. And for the record, I'm Delegate Jay Walker, Prince George's County. House Bill 444 is dealing with innovative recreational youth programs. So often, this is something that's specific for Prince George's County through Montgomery County Park and Planning, or through Maryland Park and Planning, sorry. Maryland, Montgomery County opted out, but they did support the bill. The amendments that you see have been drawn up in conjunction with Park and Planning. These are the amendments that they suggested. Quite simply, what it does, if you take a look at my virtual background in the back, when that community center was being built by then Council Member Obie Patterson, who's now my Senator Patterson, we got the community input. The senior citizens wanted to make it senior citizen friendly, while the youth, the youngsters, we call them, they wanted some place where they could do gaming, and they wanted a DJ booth and things like that there. So in doing so, we start thinking, well, doesn't Park and Planning stay ahead of the curve? I mean, ahead of the curve is, we all know that most park systems have a difficult time just funding the major sports: football, basketball, baseball, soccer. Innovative youth sports are the new fastest growing sports. So this would be the creation of an establishment of a fund that is earmarked to look for these games that are being played out there that we don't necessarily give access to. In Prince George's County, it's a little bit disproportionate. The fund would go towards things like skate parks, remote control car racing parks, cheer parks. How many of y'all know what pickleball is? Pickleball, Senator Kagan, pickleball, fastest growing sport in the country. So pickleball courts. Lacrosse is growing in Prince George's County. We don't have any lacrosse walls. So things of that nature is what we should use. And I don't even know what a pump track is, but I was told pump tracks are what Park and Planning wanted. So what this does is creates the establishment of a fund to be earmarked for non-traditional recreational sports to keep us ahead of the curve, and also to help those kids or those youths or everybody in the county that they can be represented. And it came out favorable, and I'd ask for a favorable report.
Thank you, Delegate. Ms. Borden with Park and Planning, would you like to say a few words?
Thank you, Mr. Chair. We would just wholeheartedly support this bill as amended. We did work with Delegate Walker on it, and we're so happy with the results. And we do think that this is going to really spur our innovation in our Parks Department.
Thank you. Delegate Walker, some people say pickleball is tennis for old people. But I don't want to alienate anybody here.
Yes.
Any questions, Senator Washington?
Thank you. I support this very much. I serve on the board of the Parks and People Foundation in Baltimore City. We've had about 20 years of investing in what we call non-traditional urban sports. So that's because of code, and it works out very well. So, you know, I got a couple of emails about it, but I'll follow up with the bill sponsor. But I think this is a great idea, and it works out really well. So thank you for bringing it to us.
Thank you.
Thank you, Senator. Senator Kagan, Vice Chair.
Thank you very much, Mr. Chair. Probably a question for Ms. Borden, unless Delegate Walker wants to chime in on this. There are basketball courts for people in wheelchairs and other disabilities that kind of level the playing field. I wonder if Park and Planning is aware of that, and if that's the sort of opportunity that might be created on one of your sites.
We certainly are aware of that, and we have been working tirelessly to make sure that we have opportunities for people of all abilities to use our facilities. We've done a wonderful job of that, and if you'd like to hear about it, we can absolutely reach out to you with a big and growing list of all of the different facilities that we have in both counties that reach out to everyone of all abilities. We are very, very focused on that, and we're happy to share.
That's great. Well, glad to hear it, because I've played basketball on those, both in Maddie Stepanek Park, as well as by the Rockville Municipal Swim Center. And it's just really fun. It's hard, but it also does, you know, regardless of your abilities on basketball or physically in general, it's a fun equalization. So thank you. I'm glad for the answer. Thank you, Mr. Chair.
Thank you. Thank you, Delegate Walker. Thank you, Ms. Borden. That concludes the hearing on that legislation. We're going to go to Delegate Borden, Prince George.
Mr. Chair, I was trying to get in there. I guess you didn't see my reaction there, but might I just,
Please.
Thank you. First of all, let me thank Delegate Walker for bringing this bill before us today. He has certainly been a longtime supporter and a champion in this particular area. I guess just my concern, and I don't know if the rep from Park and Planning might be the appropriate person to respond. Is this a jointly sponsored program between Prince George's County and Montgomery County, or just strictly Prince George's County?
Sure. With the amendment there, the establishment of the fund would be just earmarked for Prince George's County for that. So
okay. How would those funds be distributed? Will there be a board, or will Park and Planning manage those funds?
Yeah, Park and Planning would manage the funds, and they've got the personnel, board could help out. They've got the personnel to earmark where this would be a dedicated group specifically for that. So, you know, you've got, you know, ice hockey rinks and different play rinks. They'd have a
ice skating ring. Don't forget.
Yeah, got one of those too. Yeah. So it would be earmarked. Their job would be to go out and find ways to stay ahead of the curve.
Will they also be responsible for helping to secure funding?
They absolutely, because they've got the funding. So
okay.
They do that.
But they got
disc golf. I like disc golf too. That's a fast growing sport too, which is in Prince George's County. We only have one disc golf course in the whole county. So things like that.
All right. Thank you, Mr. Chair.
All right.
Thank you, Senator Patterson. Thank you again, Delegate Walker. That concludes the hearing on that legislation. We're going to go to 977, since we're on the Prince George's County roll, and take Delegate Borden, and then we'll be followed by Delegate Morgan, St. Mary's County. Prince George's County Public Safety and Behavioral Health Surcharges. Welcome, Delegate Borden to EHE.
Thank you so much, Mr. Chair. For the record, Delegate Eric Barron, I'm before you today in my capacity as Chair of the Prince George's County House Delegation. This bill is a local bill supported by the House and Senate delegations, and it's a clarifying bill, and a bill that expands the use for our surcharge surcharges on certain developments, and just really is kind of part of a growing recognition that behavioral health and public safety go hand in hand, and expands the potential use of the surcharge funds for behavioral health purposes. So it's a very simple bill. I'll end it right there. If there are any questions, I'm happy to try and answer, but we urge your favorable report.
Thank you. Any questions for Delegate Borden, Chairman of the delegation? Seeing none, thank you, Delegate Borden. Thank you very much. Okay, that is it. Now we're going to go back to 527 St. Mary's County Delegation, Human Relations Commission, Delegate Morgan. That's the first of two he has. Delegate Morgan, welcome to EHE.
Thank you, Mr. Chairman. First, the bill 527, that's our Human Relations Commission. We're changing a mission statement in there to try to just be more inclusive and just simplify it. It changes the statement to encourage and ensure equal treatment of all people in compliance with federal, state, and local laws and regulations related to housing, employment, and other public accommodations. With that, I'd be happy to answer any questions, but that would conclude my hearing. The bill does have delegation support and local county commissioner support.
Thank you. Questions, Senator Washington.
Thank you, Chairman. I'm having a problem with my Wi-Fi. I'm not able to pull up the bill. What's being changed? We're
striking some language in the commission. Strike some language. So the statement I just read you, encouraging and ensuring equal treatment of all people.
Right.
We're striking the language without regard to race, color, religion, ancestry, national origin, sex, age, marital status, and physical or mental disabilities. All that's wiped out. It's just all people. So in compliance with federal, state, local laws and regulations related to housing, employment, and public accommodations.
Okay, that makes it clear. So it's striking out specific naming of specific recognized groups in the law and extending that to the term all people. Is that?
Yes,
is that,
ma'am.
All right, thank you. Thank you.
Just be more inclusive.
Mr. Chair.
Senator Ellis.
Yeah, thank you, Mr. Chairman. Thank you, Delegate, for this bill. So in federal law, state law, there's protected classes. So this bill is getting rid of that and just saying all people. And
no, it's not getting rid of protected classes.
I'm sorry. I was finishing my question.
Oh, I'm sorry. Go ahead.
So, so federal law, state law have protected classes of individuals that certain laws apply to. And so is this bill getting rid of that and saying all people instead of respecting the historic discrimination that happened to certain peoples and that's still happening today?
No, this bill has nothing to do with getting rid of any type of protective class. This has to do with the Human Relations Commission that's set up in St. Mary's, and it was, streamlining their scope and practices to be more inclusive.
More inclusive of what?
Asked for this. What?
Sorry?
The commission has asked for this. So,
I know, but you're presenting the bill, so I just want to understand the bill. So when we go to vote on it, I can cast a informed vote.
Yeah.
So in this bill, in the commission, does it still respect that you have certain folks who have been historically discriminated against and their laws protecting them? Will this all peoples get rid of that? Could you?
No, this historic groups that have been discriminated still exists. That has nothing to do with the mission statement there. It's a changing of mission statement of all people. So the protected class and then the other section of the bill, maintain a list of public accessibility website protected classes of people in federal, state, and local laws and regulations related to housing, employment, and public accommodations.
Yeah, I'm sorry, you read that kind of fast.
Yeah, it's subsection 3 under the bill. It says The other scope of the commission is to maintain a list on publicly accessible websites of protected classes of people and federal, state, and local laws and regulations related to housing, employment, and public accommodations.
So this is called my list and not, but I'm.
Right.
it's
So
back
that's
to
the point of the commission, is to make those publicly accessible websites and for all protected classes. There, websites, relating to housing and public accommodations and employment.
Yeah, so that's in the back of the bill. So in the front that you're changing, you're getting rid of the main.
Well, it's changing. I mean, it's naming that as a scope as well in the bill. So it's in your official copy.
Well, I mean, I won't have the opportunity to speak to you during the voting session. So it's very important we have this discussion. And I can't read the bill while I'm talking and listening to you. I can't multitask like that. I apologize. So it's very important for you to be able to present your bill and answer the questions as asked, and not judge why I'm asking it and tell me it's in the bill. So anyway, I guess I would have to end this. I know we have a lot of bills to go, but thank you, Mr. Chairman.
Thank you for your question.
Thank you, Senator. Senator Washington.
Thank you, Mr. Chair. Again, Delia, thank you. Are there currently currently in the mission of the committee, are there current statuses that are not in the law that should be protected? They're not currently, so you say all people. Are there specific groups that don't currently appear in the law that
I don't believe so. Like I said, this is a commission set up to provide resources.
Right. No, I get it. These commissions are, so for example, Baltimore City's, has a number of a list. And so we went through the list. Finally, Wi-Fi is working. So you have race, color, religion, ancestry, national origin, sex, age, marital status, physical or mental disability. Is there another category that is in Maryland state law that does not currently appear in this in the commission's mission?
I'm not sure about that.
Okay, I think there is. All right, we'll see what we can do to add it. Thank you, Mr. Chair.
Yeah, and we can ask committee counsel of comparing federal, state, and local lists as well.
Thank you.
Vice Chairwoman Kagan.
Thank you, Mr. Chair. So Delegate Morgan, I, like my colleagues, am having trouble with this bill.
Okay.
I see that it passed unanimously, so I don't know what your colleagues in the House saw that we're not seeing here. So first off, current law, lines 6 and 7. The commission shall use its influence and persuasion to direct the efforts of the community to solving problems that many times are the basic reasons for racial tensions. Racial tensions aren't the only tensions. I mean, again, then
Where are you seeing this at?
Lines 6 and 7 on page 2. It's part of current law. So I'm reading the whole section. So first off, I'm surprised that it just references racial tension and not, which doesn't deal with attacks against Muslims or Jews or gays and lesbians or, I
believe that's the reason why switching it, instead of calling out every single minority group that may exist or may not exist, it's simply changing it to all people.
Yeah, no, that's in section 2.
But
I'm in section 1. It just says racial tensions, and I just think that's narrow for a commission of its import. Anyway, moving on then to section 3, which is the new section of the bill, the proposed law. I'm just confused as to what it's going to accomplish. Maintain a list on a publicly accessible website, got that, of protected classes of people in federal, state, and local laws and regs related to housing, employment, and public accommodation. So first off, there are a lot of protected classes that are in criminal law. Again, I mean, just whether that's assault on Asian Americans that we've been distressed to see lately, whether it's gays and lesbians who are being beaten up, whether it's religious people being shot in their places of worship or attacked. I mean, I'm just confused as to what.
I'm confused where all people wouldn't fall into that category. Usually,
so first,
like
yes.
minority groups, and they would fall into all people.
Right. Yeah. So I understand, but again, Delegate Morgan, you're in section 2. I'm in section 1 and then in section 3. I understand what you do in section 2, which I'm not sure I think is the right direction, but I'm leaving that aside. So section 1, I'm wondering why it's just racial tensions, and then section 3.
Well,
so hold on, let me finish. So I wonder, can you just tell me, magic wand, abracadabra, this bill becomes law. Tell me what's going to be different after this bill is law that doesn't happen now. What is this list? Is the list just going to be?
It's the
what's the goal of it?
Set up a list of publicly accessible websites of protected classes of people for the federal, state, and local laws and regulations related to housing, employment, and public accommodations.
Delegate Morgan, I can totally read. I got the words.
Well, I mean,
I don't understand what the goal is or how this helps the commission do its work, and whether it's parts of it seem too narrow and parts of it just seem ineffective. Anyway, all right, we can either talk offline.
Well, I mean, it's existing commission right now, so.
Yeah, okay, yeah, we definitely got that. All right, thank you, Mr. Chair.
I think it's pretty straightforward in strengths and weaknesses. We will take it up. I think we've tried some questions.
Moving on to the next bill, Mr. Chairman?
Yeah.
Thank you, Mr. Chairman. HB 1097 is a local St. Mary delegation bill dealing with salaries of public elected officials. We conduct a commission every, well, I believe it's every 4 years to look at the salaries of our elected officials. And this does raise a few salaries for our Board of Education members, as well as our Commissioner President members, which didn't get a raise the previous 4 years. So with that, it has local delegation support and county commissioner support. And I humbly ask a favorable report, and I'd be happy to answer any questions on it.
So this review is of all local officials, not just some local officials.
It's all local officials, but like I said, all of them are getting a raise here.
Seeing no further questions, that concludes the hearing on 1097. Thank you for joining us.
Appreciate it. Thank you.
I hope it's been a pleasure. Okay, let's go to Senator Kagan. You've got 3 or 4. Let's knock them out.
I do.
We're going to start with 464.
Yep.
501.
Yep. All right, Mr. Chair, it seems a little unfair to go after Delegate Morgan in that bill, but I'm going to do my best. House Bill 464 is about park and planning, who were here earlier. There are agencies that, and I see Deborah Borden is here. There are agencies that have to submit applications, and within 60 days, if the park and planning folks haven't said no, then it's assumed that everything is copacetic and it's going to be complete and fine.
All right.
Inefficient. Mary, yeah. So this bill would close the loophole and establish a guideline as to what a completed submission is, so that there's better collaboration and communication between the applicants and park and planning. Within 3 business days, park and planning would have to acknowledge that the application is either completed and accepted or incomplete and rejected. And they're going to list what it is that's missing. And I think that's just going to all make everything go better. If after 3 attempts, they don't have the information, like there just needs to be action, not a default of approval. This passed the delegation unanimously, the Senate delegation, the House delegation, and I move the favorable report, Mr. Chair.
Thank you, Madam Vice Chair. Ms. Borden, you want to add anything?
Yes. Deborah Borden, Deputy General Counsel for Park and Planning. I just want to specify this is for public projects in Montgomery and Prince George's counties only. And it's because public agencies are not subject to local zoning. So the Park and Planning Commission reviews public projects in order to give our expertise on master planning, community planning, environmental, historic preservation, all of the areas that we have expertise on. We give those recommendations. They are not binding to the public agencies. We have 60 days to complete the review. And in order to do that, we reach out to them every year, asking them to tell us what they have in the pipeline, tell us what projects that are coming, so that we can make sure that it's planned and that they have built-in time within their schedules to handle the mandatory referral review. And we've created great lines of communication with all of the public agencies that are our frequent flyers who come to us regularly. We even have coordination agreements with them that preset how their projects will be reviewed by us. And so the legislation simply fills out what is really sort of an empty vessel at this point. The law just says mandatory referral shall be done, but it doesn't tell us at all how it shall be done. And so we're filling in the blanks with really what we're already doing. This is already in place. When we get an incomplete application, we call or we send an email saying we need a landscape plan or we need whatever. And this legislation just puts parameters on that to say we can't do that endlessly. There has to be an end where we just shrug our shoulders and say, okay, we're not going to get all the information that we want. We have to just move forward and do the best we can with the information that we've been provided. So I did see the letter from DOT, and I do think that there's just a misunderstanding as to how the process works. So I'm happy to answer any questions, and I hope that you will vote favorably for this legislation. Thank you.
Thank you. Questions for Vice Chair or Ms. Borden? We have one opponent we'll get to in a moment. Seeing no hands, we will go to Edgar Gonzalez in opposition.
Thank you very much. Can you hear me? Hello?
Yes, we can.
Okay, thank you. I'm having trouble with my video. I don't know what happened. But anyway, so here we go. Thank you very much, Mr. Chairman, members of the committee. My name is Edgar Gonzalez, Executive Director of the Suburban Maryland Transportation Alliance. I'm former Chief Engineer and Deputy Director of the Montgomery County Department of Transportation. During my 40-year career with the county, I was involved in at least 300 mandatory referral projects. The current process is onerous, but it works. I will summarize the main 3 reasons for my opposition to this bill as drafted. Number 1, delays and cost increases. During 2019 and 2020, the board met about every 6 business days, but the legislation requires the commission to determine if a submission is complete within 3 days. Therefore, this decision will typically be made by a staff member and not by the commission. Any staff member in the chain of command can delay a project which has been approved by the federal or state governments or by a county executive and council by simply stating that their submission is not complete for any insignificant reason. Delays of up to 180 days would result with a negative effect on project schedules and cost. The commission should not be allowed to define what is complete on their own. It should be included in the law. 2, lack of definition of what is complete. The commission receives mandatory referrals for land acquisition, for planning level projects and construction projects. They all have different levels of engineering completion and require different levels of engineering drawings or not drawings at all. The bill should at least be amended to clearly state what constitutes complete submission for each type of project. 3, resubmissions. The bill should be modified to address the cases in which the commission finds a submission as not complete. A second submission could be required within 30 days of rejection by the commission, and the commission should take action within 30 days of the resubmission. The applicant then would be required to explain why any comment from the commission cannot be met. As a former public servant with 40 years of experience in mandatory referrals, I can testify that the existing process works. The proposed bill is unnecessary. It creates unreliability. It gives too much authority to staff members without the approval of the commission.
Mr. Gonzalez, you've got to wrap it up.
And will result in a lengthy delays and cost increases. For all of these reasons, the legislation should receive an unfavorable report. Thank you very much.
Thank you, sir. Questions for Mr. Gonzalez? Seeing none. Yes, Vice Chair Kagan has one short question.
Very quick question. Mr. Gonzalez, you didn't testify when the delegation was first hearing this bill and starting to craft this so that you could offer amendments or anything. Is this something that you just recently had a concern about, and do you have any suggested amendments that would address concerns? Because this seems pretty simple and it seems like to be about collaboration and communication.
I became a member of the Suburban Maryland Transportation Alliance within the last month. So I wasn't aware that the bill was going on before. I was not involved in it. So when I realized that this was happening, I said, geez, I had dealt with this issue way too many times in my life, and it's not always as cooperative as it appears or it has been stated here. Any member of the staff that is in the chain of command can stop the project. So I do have proposed amendments that I would be glad to submit. I have them here in front of me. I'm new at this process, unfortunately. So I do have specific amendments that I have in front of me, and I can email them to the vice chair, the chair, the whole committee.
Great, thank you. Okay, that completes the hearing on that bill.
Thank you.
To the final Montgomery County Bill 501.
I think there's one more after that one, but yes.
Oh, I'm sorry.
That's okay. But these are both, I mean, I think they're all going to be.
No, it's 789. I'm sorry. 789.
No, 501 is the one we're going to go to next, Mr. Chair, unless you want to go in another order. We just did 464. Next up would be 501 if we're going in numerical order, or we can go.
I'm jumping ahead. 501 is correct.
501 it is. Okay. This is going to be really brief. WSSC, and I appreciate Ms. Borden sort of coaching me on the reality that not everybody knows all these acronyms or agencies. WSSC is the Washington Suburban Sanitary Commission. It is a bi-county agency along with Park and Planning that work in Montgomery County and Prince George's County. This is water and sewer, and they generally do terrific work. But we have a whole bi-county subcommittee in the delegation to deal with oversight and legislation for those two entities. So WSSC requires financial disclosure, just like we do, and many people who are on boards and commissions in the state, but only above a certain level, and it's above a grade 12 or above. Those are holding decision-making authority. There is no consequence if you file late. And so this bill simply says $5 a day up to $500 if you don't, if you file late. And that's what the bill does. It passed unanimously in the House, in the delegation, Senate and House delegations. And I see that Guy Andes is here from WSSC to answer any questions. Would request a favorable report. Thank you, Mr. Chairman.
Questions on the bill to the sponsor or Mr. Andes from WSSC? Seeing none, that completes the hearing on 501. Now we'll go to 789.
Excellent. Okay, I guess formally, I didn't introduce myself on any of these, but for the record, Cheryl Kagan, very proud to be the senator for Gaithersburg and Rockville, and representing the entire Montgomery County delegation on these local bills. So this one is about transparency, and it's about, again, WSSC, Washington Suburban Sanitary Commission. As committee members may remember, in the past several years, we continue to enact legislation requiring greater transparency. In the time of the pandemic, we've all seen how important that has been, and our constituents and advocates have been able to follow along our work by watching our hearings stream live, by watching even our voting sessions stream live. And WSSC, the Washington Suburban Sanitary Commission, has been streaming live. And this bill just would make sure that that continues so that residents of Montgomery County, Prince George's County, and anywhere around the world can follow along after the pandemic is done. It also authorizes the WSSC Customer Assistance Program to reduce or waive water and sewer bill fees. WSSC supports the bill, and again, it passed unanimously in the House delegation, in the full House, in the Senate delegation, and I would request a favorable report from the committee. Thank you, Mr. Chair. And Guy Andes is still here.
Mr. Andes, do you want to add anything?
Mr. Chairman, I don't have any comments, but our legislative intern, if you would indulge us, would like to provide some comments, if you don't mind, real brief.
Is this Jared Maddox?
Yes, sir.
Yes, sir. Yes, sir.
Okay, this is not a PowerPoint, correct?
No, sir. Brief statement.
Maddox, please.
Thank you. Thank you. Hello, Mr. Chairman, Madam Vice Chair, and the members of the committee. My name is Gerard Maddox, and I'm the legislative aide for the Intergovernmental Relations Office here at WSSC Water. I'm here to testify in support of House Bill 789. House Bill 789 requires the commission to stream live video or live teleconference audio or other audio if it's an open meeting, and to maintain and complete unedited archive recording of each open meeting. Provisions have been added to protect the validity of any action taken by the commission in the effort in the event that a technical failure prevents the meeting from being reported. Additionally, House Bill 789 specifies the financial assistance provided as a part of our customer assistance program, and it can include reduction or waiver late fees. This expands the assistance WSSC can provide to our most vulnerable customers. Before I conclude, WSSC would like to thank the bill sponsor for working with us and the commission's concerns while maintaining their legislative intent for the bill. WSSC Water requires a favorable report for HB 789, and thank you for your time. And if there's any questions, I do have Guy here with me.
Thank you. Any questions?
Mr. Maddox did a great job, and Mr. Andes, I love that you are backing up Mr. Maddox and are available if we've got questions. I think that's
the junior partner, I think is what it's called. Okay.
Good job, Mr. Maddox.
Seeing no questions, and we have a lot more bills that
Thank you so much.
hearing on that legislation. Thank you all. We're going to go to 801, Delegate Clark, Calvert County Public Safety.
Thank you, Mr. Chairman. Delegate Jerry Clark, District 29C, Calvert and St. Mary's County. I'm glad to be representing Calvert County today instead of St. Mary's on these bills. I have for you today HB 801. It's a public safety bill for building use for agritourism. Bill is simple. It only adds Calvert County to a list of counties which are exempt from obtaining a change of occupancy permit for the use of agritourism. 10 other counties already are on this list: Allegheny, Anne Arundel, Baltimore, Carroll, Cecil, Garrett, Howard, Kent, Prince George's, and St. Mary's County. Chapter 672 in 2018 defines agritourism. The agricultural buildings used for agritourism in Calvert County are also exempt from adhering to the Maryland Building Performance Standard. This bill is a natural extension of these laws. The bill is supported by the Calvert County delegation, Calvert County Board of County Commissioners, Southern Maryland Association of Realtors, Southern Maryland Farm.
We're good, Delegate Clark.
In the Maryland.
Impressive list.
And then former Secretary Hance was going to testify. I told him that time was tight, so he said he'd be out in the field plowing, and he'd see you next time.
Yeah, I think time spent on the farm is probably more appropriate. You're added to the other 9 counties. Any questions, Delegate Clark? Seeing none, that completes the hearing. Thank you for coming over, even if it is virtually, Delegate Clark. That completes the hearing on 801.
Okay, thank you.
Yeah, thank you. Is Delegate Charles with us?
Hi, my name is Morgan Hackey, and I'm Delegate Charles' legislative aide, and I'm going to be speaking on his behalf.
Please proceed.
All right. Thank you, Senator Pinsky and distinguished members of the Education, Health, and Environmental Affairs Committee. I'm thankful for the opportunity to testify in support of HB 7873. My name is Morgan Hackey, and I'm a legislative aide for Delegate Charles. This important piece of legislation proposes requiring the State Board for Certification of Residential Child Care Programs professionals to maintain an electronic roster of all individuals certified by the board. This electronic roster would then be made available for verifying certification purposes on the board's website. If an individual does not have access to the board's website, they may contact the board to verify certification. Additionally, this bill will alter the language used in renewal notices for child care programs to facilitate easier renewal. Currently, there are 1,200 certified residential child care and youth care practitioners and 74 certified residential child care program administrators employed in Maryland's residential child care programs. They are tasked with delivering therapeutic residential care to youth services in group homes, licensed by Maryland Department of Health, Department of Juvenile Services, and the Department of Human Services throughout Maryland. RCYCPs perform the direct responsibilities related to activities of daily living, self-help, socialization skills in a residential child care program under the direction of a certified residential child care program administrator for Maryland's most vulnerable youth. The State Board for Certification of Residential Child Care Program professionals' mission is to protect children living in Maryland's residential child care programs and promote quality of care in the field of residential child care. By requiring this board to maintain an electronic roster of their certified individuals, Marylanders will have better data to transparently research whether a residential child care program is meeting the standards of regulation. This would be a protective measure to ensure Marylanders know exactly who their children are in the care of. The state of Maryland thrives when we have increased transparency between our boards and our constituents. HB 873 requires a unique opportunity to ensure Marylanders know that the residential child care and youth care practitioners in our state are continually meeting board expectations. This transparency and increased access to data is why I encourage a favorable report on HB 873. Thank you.
Thank you. Ms. Ham.
Yes, thank you, Mr. Chairman and members of the committee. My name is Darlene Ham, and I'm the Executive Director for the State Board for Certification of Residential Child Care Program Professionals. I'm here today in support of House Bill 873, revision to the Maryland Code Health Occupation, Article 2307. For the sake of time, I'm here to answer any questions and or provide any clarification that you may need today.
Thank you, Ms. Ham. A question for Ms. Hackey or Ms. Ham? Seeing none, thank you. That concludes the hearing on that legislation. Thank you both for your patience.
Thank you.
Delegate Gilchrist, do I see you?
Good afternoon, Mr. Chairman.
Yeah, thank you, Delegate. We're moving to 992 Natural Resources, Maryland Environmental Trust. Welcome back to EHE.
Thank you, Mr. Chairman, members of the committee. I'm Delegate Jim Gilchrist with House Bill 992, which concerns the Board of Trustees of the Maryland Environmental Trust. The Board of the Maryland Environmental Trust works with landowners across the state to protect our most treasured landscapes. One of the most successful land trusts in the country. It preserves over 130,000 acres currently. In 2016, the legislature made changes to how the board is selected. Prior to that, it was a self-selecting board. In 2016, the legislature changed it to appointments, or a process where the governor, the president, and the speaker each send names to the board. The governor sends 3, the president sends 3, the speaker sends 3, and then the board selects 2, 1, and 1. This has created a process that's a bit unwieldy. Especially you ask people to volunteer on this board that does such important work. And if the president or the speaker submits the name, you're basically saying to that person who's volunteering, you have a 2 out of 3 chance of being rejected from being on this board. So what this bill would do is change the process so the governor selects 2 each year, the president selects 1, and the speaker selects 1. Right now, we don't have a full 19 members of the board, partly because of this cumbersome process. Also, the bill would delete the provision that calls for the 10-member quorum, because we don't have the full 19 members of the board. This would allow the board to set in bylaws what the number should be, or how that should be handled. Mr. Chairman, members of the committee, you should be aware there was a Senate bill that was withdrawn. It was Senator Eckert. She is also on the MET board. She's concerned that the board did not take a position. There's not consensus on the board about this, and so you should consider that as well. I talked to the board chair yesterday. I haven't talked to Senator Eckert in a couple of weeks, but I can do that again shortly.
Okay, questions for Delegate Gilchrist? Senator Kagan.
Thank you, Mr. Chair. Hello, Delegate Gilchrist. Welcome back to EHE.
Good to be here. Hi, Senator Kagan.
So I'm looking at, you said that the Maryland Environmental Trust didn't take a position, but I'm in the testimony and it has their unfavorable testimony in here. Is there something about that has changed? Is this outdated? But I see it's dated March 26th and addressed to Chairman Pinsky.
I'm sorry, I have not seen that.
Okay. Yep. Okay. I'm sure we can get you a copy of it, or I can, or something, but happy for your response to that prior to the committee's consideration. Thank you, Mr. Chair.
Thank you. Further questions? Seeing none, thank you, Delegate Gilchrist.
Thank you, Mr. Chairman.
Okay, now, speaking of time, we're going to 10:13, standard time. We will not keep a clock on you, at least Delegate Crosby, but this is a somewhat controversial bill coming very late to the Senate. We will have Delegate Crosby explain it. We have a couple people in support and some in opposition. So with that, this year-round daylight savings time. Delegate Crosby, welcome back to the committee.
Thank you so much, Mr. Chair. I appreciate the puns. Good afternoon. Good afternoon, Madam Vice Chair and distinguished members of clearly my favorite Senate committee. For the record, Delegate Brian Crosby here to present House Bill 1013 entitled General Provisions, Standard Time, Year-Round Daylight Savings Time. This bill simply would formalize Maryland's intent to remain on daylight savings time. So if you think about it this way, we would spring forward next year and then remain there forever. Granted, I can get into some of the details here in a second, but we would just jump forward and then your clock would never have to move again and we could end this madness. So the bill is contingent on 2 things. The first, similar legislation is passed in each state that immediately surrounds Maryland. That was the intent of the House committee, and I fully support that. Uniquely enough, Delaware already has enacted it, and Pennsylvania passed theirs yesterday. And the federal government would also have to amend the Uniform Time Code to allow for this to go into effect. Frankly, the impetus for the bill is nothing more than annoyance. The practice of shifting clocks has been, backwards during the winter months, was originally adopted during World War I to conserve energy. It went away for a brief amount of time and then it came back in under World War II. And studies show that it's negligible on saving any kind of energy costs across the board. And that's why I think we're seeing this shift by many states to do away with it. The reason I brought forward daylight savings time rather than standard time is, frankly, I just took a poll. It was pretty widely, I would say there was over at least 100 people, and the results came back overwhelmingly in favor of having the additional hour in the evening. But this is, frankly, more than just an annoyance. There are significant health risks with messing with our circadian rhythm. The week after our clocks adjust, either way, I think that's important because people only think of it as being negative when we go forward, but there are impacts when we go back. The increase of heart attacks, strokes, workplace injuries, there's lower work output. There's first responders see a spike in suicides and fatal car accidents. So this really does touch on a real public health aspect of our everyday life. I just real quickly want to touch on the opposition. You're going to hear about shifting school start times. I'm not against that, but this bill doesn't deal with that. That is really a matter of local control and for the local board, school boards to deal with. And frankly, there is a lot of evidence and research that goes into later start times, and I agree with that, but this is not the bill that deals with this. And then second is you'll hear for why not standard time over daylight savings time. And the reality is that the shift is happening towards daylight savings time. I talked about my poll, but really we've seen 15 states, well now 16 states, put into effect year-round daylight savings time. There's another 40 or 42 states in total have considered this over the last 2 years. And I think probably by the end of the year, we will likely see about half the states putting this into place in daylight savings. So I think that if we're going to do it, we should probably be consistent across the movement. So we don't want Pennsylvania and Delaware to go on daylight savings time and then we're on standard time. And then B, I think that, the whole nation is going this direction anyway, and we should probably just get on board and make the shift with them. And for those reasons, I urge the committee for a favorable report on House Bill 1013, and I'm happy to take any questions.
Thank you. Scott Yates, are you with us?
I am, yes. Thank you very much.
You're on.
Thank you, Mr. Chairman, Madam Vice Chairman, members of the committee, and Delegate Crosby. My name is Scott Yates. I'm the leader of the international movement known as Lock the Clock, otherwise known as the guy who writes about daylight saving time on his blog on nights and weekends. This is just a hobby for me. I've been at it for 7 or 8 years now. When I first started, there was nobody that was really working on this issue, and I'm the one that sort of gathered a lot of that research that Delegate Crosby talked about with increases in traffic accidents and heart attacks and all of that. And nothing happened for the first 3 or 4 years I was working on this. I went and testified in Nebraska, and the general feeling I got was, well, we don't want to be the first state in the country to do this. And then I went and testified again this year in Nebraska, and they were like, well, we don't want to be the last state in the country to pass this thing. So they're probably going to pass it in the coming days. As Delegate Crosby said, we're probably going to hit 25 states this year. There was a poll that came out recently that was the best poll that I've seen in recent times that came from Politico, that it was 68% of people approved of the Sunshine Protection Act, which is a bipartisan bill currently working its way through Congress. 68%, 45% strongly in favor, 68% total in favor, and only 14% opposed. It's hard to imagine a substantial piece of legislation that has only 14% opposition. And so anyway, I'm happy to answer any questions. Just real briefly, Senator Crosby mentioned it, but there's always talk, and it's always emotional, and it's not fact-based at all about the danger to school children in the mornings. The fact is, overall, if we were in year-round daylight saving time, there'd be a 13% reduction in pedestrian fatalities. 13% reduction in overall pedestrian fatalities. It's just safer for people if there's more sunlight later in the day, especially for school children. Anyway, you've got the all the tailwinds at your back. This is a great bill. Thanks to Delegate Crosby for introducing it, and happy to answer any questions.
Questions before we go to the opposition? Questions for Delegate Crosby or Mr. Yates? Okay, we'll go to the opposition.
Sorry, Mr. Chair.
Yes.
Okay. So, thank you, Mr. Chair. There's no time like the present to ask a question, right? So Delegate Crosby or Mr. Yates, I'm struggling with the idea of passing a bill, enacting a law that then we have to wait for everybody else to see if they're going to take action. And then if we're going to do it, then there needs to be another slippery slope in terms of changing school times and all that. Are there other, if school times change, then that means a working parent's work schedule would have to change, which means daycare might have to change, which means bus schedules or, train schedules. Can you just talk me through, help me with the slippery slope of what else we would be the net result? And I'm aware of this issue. I have gotten emails about, my kid waiting at the bus stop in pitch dark in the morning and all that. But I think you answered that well. But if you can talk about some of the other consequences, that would be helpful.
Senator Kagan, thank you. And Scott, you can jump in here, but the reality of the situation is nobody's asking for later start times. In St. Mary's County, our middle schoolers already start at 6:30 in the morning. They stand at bus stops in the dark. And we got the traffic reports of incidents or accidents involving pedestrians. And it doesn't seem like the data suggests what the opponents are putting forward. Frankly, while I touched kind of on the research aspect of starting later, I think that's up to local school boards. And honestly, I don't think that they need to do that based on this bill. I mean, that's just kind of where I come down on that, because you are right. When you adjust school times, now all of a sudden you're adjusting daycare, you're adjusting, work times, that all goes into account when you actually move the school start time. So I'm fully aware of that. I'm not trying to go into that aspect of it. All I'm trying to do is, frankly, keep the clock the exact same way year round.
If it's all right, Mr. Chairman, could I answer a little bit further?
Extremely briefly, we have a voting session and 2 more bills. So I'm going to start cutting people off.
Okay, there are 2 bills going through the U.S. Congress right now. The one that has the most co-sponsors and the most possibility of being passed would just put the whole country on permanent daylight time. I'm working with the sponsors of that bill every week. As soon as we get it into markup, what I'm going to be proposing is that we actually extend the adoption of that so that school districts have time to figure out what the sunlight is going to be relative to the clock. And so I think that's an important point. And then also there are going to be some states that may want to be on standard time. Maryland, I think, is probably going to want to be with all of its neighbors who have all expressed an interest in being on permanent daylight time.
Thank you. We're going to move to opponents, but I don't want to use the power of the chair, but let me explain. We haven't heard from school systems. We haven't heard from PTAs. There are 5 days left in session. I have a concern of whether all the questions that we know and we don't know that Vice Chair just talked about haven't been answered or even accumulated. So I do have a concern taking this up for the first time with 4 or 5 days left in session without getting data. I see one school system has written a letter of information. We haven't heard from PTA and a lot of other school systems as well. So there are some concerns. That being said, we're going to go to the opposition. Ms. Van Buskirk, followed by Mr. P, followed by Mr. Eichner. Please be additive and talk to us if you can avoid reading a speech. Thank you.
Good afternoon, Chair Pinsky, Vice Chair Kagan, and members of the Education, Health, and Environmental Affairs Committee. Thank you for the opportunity to testify in opposition to HB 1013. I'm Lisa Van Buskirk, the leader of Start School Laters, Maryland and Arundel County chapters. My written testimony includes my SB 840 testimony that I had before you on March 11th. Since my oral testimony last month and the passage of HB 13, I've thought some more about what permanent daylight savings times means for Maryland, especially after our change on March 14th. Do you remember feeling slightly groggy that morning and the next day due to social jet lag from Maryland sunrise moving from 6:20 to 7:18 overnight? Imagine that grogginess and social jet lag lasting and indeed worsening for the entire month of November, December, January, and February due to delayed sunrises as late as 8:39 in our state. Our nation, indeed our world, has put health and safety at the forefront of our lives for the past 13 months. While the debate is far from settled regarding how high a priority safety, health, and the recommendations of experts should be accorded in our daily lives, we would be remiss to ignore the research that recommends that permanent daylight savings time is unhealthy and unsafe. Do we prioritize research studies and the lessons learned from the failed 1974 permanent daylight savings time experiment, or do we ignore them just because people think they like later daylight savings time? It doesn't change the number of hours of daylight, it changes when that daylight happens, with more of us commuting and going to school in the morning. Darkness. When I brought HB 1013 to the attention of Maryland's various boards of education last month following the passage of HB 1013, I suspect most were unaware of it because it's not a direct education impact. Several, including Montgomery, Prince George's, Howard, and Anne Arundel, did express to me concerns about the impact of delayed sunrise on their students' health and safety. I don't know if any of them had time to formally write anything besides Anne Arundel County to you, but I would encourage each of you before you vote on this bill to discuss with your respective boards of education and superintendents the impact of an 8:30 sunrise would have on student health and safety. If it's changing from standard time and to daylight savings time back again that annoys you, then please consider standard time. Please vote unfavorably for HB 1013, or you could amend it to include the mandate for school start times. For those that would prefer daylight savings time, then I look forward to you submitting legislation next school year to mandate safe, healthy, and age-appropriate school hours. Otherwise, please amend the bill or amend it to standard time, or just report unfavorably because it's late in the session and we need to discuss this more. This is a very serious consideration to move us to permanent daylight savings time. Thank you.
Thank you, Mrs. Van Buskirk. Mr. P.
Hello, thank you for having me here. It's an honor to participate in this process. Thank you. My name is JP. I bring expertise as a software engineer, as an amateur astronomer, and as the founder of Save Standard Time, a public benefit nonprofit that works directly with health and safety scientists throughout North America. I'm here to ask that you oppose HB 1013 and that it would be recommended to be amended to permanent standard time. I wrote a script, but there were so many points brought up. I took notes. I'd rather address those directly. I've also provided you with a letter with outlines all of my points. It has citations with links, quotes from experts. It has comparison photos showing you how the morning looks on DST versus standard time, how much darker it is with DST. So please review, if you can, those PDFs that were provided as well. There was mention of momentum for permanent DST. I would say that momentum for something bad does not make it something that you want to join in to do. I think there was mention that a bill had passed Pennsylvania just yesterday, and my understanding is that it passed its first chamber. It has not passed the both chambers in Pennsylvania. There was mention of professional polling. Most of these polls are providing a false dilemma saying, do you like to change clocks or do you like permanent DST? They leave out the option for permanent standard time. When polls provide all three options, we find that it's pretty much evenly split. And the most recent polling shows actually a slight preference for permanent standard time. There's also a marketing trouble. When you ask people about saving daylight or protecting sunshine or the summer clock, those things sound good. But if you actually ask them the reality of, would you wake up an hour early every day? Would you wake yourself up hours before the sun rises in the cold and dark of winter? You'd get a much different answer. People would be saying no. There were appeals to science. There were statistics quoted about safety. I don't know, I can't say if this is intentional or not, but these studies are showing that daylight saving time is what is causing these problems, not just the clock change. And I know that it's easy to confuse, easy to confuse DST and clock change. The language is difficult. It's time. It's a nuanced topic. But we find that every advocacy org for health and safety and education is saying we need to abolish DST, not just clock change. We need to restore permanent standard time because it lets people sleep.
Mr. P, you're gonna have to wrap up.
Okay. Finally, just to say, school start times, we should already be starting school later, and this would make it that we'd have to start it doubly later, and that it would make your sunrise as late as 8:39 in the morning and past 8 a.m. for 3.5 months.
Great. Thank you.
Thank you for this opportunity. Thank you for this opportunity again, and glad to answer any questions.
Thank you. Mr. Eichner?
Okay, hello. Can you hear me?
Can
you hear me? Can you hear me now?
We can hear you, yes.
Okay, very good. Good afternoon. It's my first appearance in front of the committee. I thank you for inviting me to join. My name is Keith Eichner. I work as an FAA weather observer in Western New York State and have been in the business of meteorology or broadcast meteorology since 1977. And I am old enough to remember 1974, when during the modern era, well after World War II, we had a period of mandatory daylight saving time in the winter, thanks to the Congress and President Nixon back during that year of 1974. It turned out that just before the changeover to the clocks being made over to daylight saving time, there was a survey done and a lot of people favored DST over standard time. And then within 3 to 4 weeks after the time change was made and we were plunged into morning darkness for many parts of the country, it turned out it wasn't so popular after all, and there were a lot of calls to have that provision repealed. Now I'm going to ask the question, at what point does DST provide useful benefits in the darkest 18 weeks of winter, especially from late autumn into, let's say, early to middle of March? Delaying the morning sunrise just to give back that afternoon sunlight makes no sense to me. And for many of us who work in the weather community, whether you're a meteorologist or an FAA observer, we actually run on standard time. Our data actually comes from Universal Coordinated Time. And we have kept our clocks on standard time year round, despite the observances of DST. So technically the records are like 1 a.m. to 1 a.m. on daylight time. But these claims being made by some that the permanent daylight saving time may help evening economic activity or after school activity or greater physical exercise doesn't do a whole lot of good for those of us who live in the northern US, where the winters are cold and sunsets tend to be early. That's part of the natural rhythm of Mother Nature. We get into early sunsets during the latter part of the year. In fact, extending it to as late as November the 7th, which will be this year, having it held off till after Halloween made absolutely no sense to me when the last federal bill was passed in 2005 and implemented in 2007. So another point I want to make very quickly, and I'm going to wrap this up, is that claims that permanent daylight time might lower air pollution in the latter hours of the day has no real scientific merit. There have been studies done and the results on that are negligible or non-existent. If anything, extending the daylight time another hour would totally increase, probably in some cases, air pollution levels, if only temporarily. And believe me, I believe that standard time in Maryland is the perfect time zone to be on year round. I'm not against daylight saving time, and originally was not. If the dates were proper, if they were starting in late April and ended, let's say, at the end of September, I'd be in favor of that, but the federal law doesn't allow that either. We're kind of either you do it or you don't. So if I have to take a side on it, I would say let's stay on the proper time zone, which would be Eastern Standard Time or 75th Meridian Time.
Thank you.
And that's what
Thank you, Mr. Eichner. Questions for the opponents? Questions for the opponents? Seeing none, that concludes that hearing. Thank you, Delegate Crosby, for joining us and sharing your legislation with us. We're going to move to the final bill of the day, HB 377, Delegate Bagnall, Commission on Student Behavior, Health and Mental Health Treatment. I do not see anyone signed up in opposition. I see some favorable with amendments. Supporters of the bill understand that there is no opposition. So each of you do not have to convince us using the same arguments. You can be more concise or additive or shorten your comments, but let's just be sensitive. We have a lot more work to do today. With that, Delegate Bagnall, I'm not meant to be dismissive of this important legislation, but welcome to EHE.
Thank you very much. Good afternoon, Chair Pinsky, Vice Chair Kagan, and the members of the committee, and thank you for your patience and your work. For the record, I'm Delegate Heather Bagnall, District 33, Anne Arundel County, and I'm here testifying on behalf of HB 377, Commission on Student Behavioral Health and Mental Health Treatment. You have my written testimony, so I'll try to summarize the necessity of this bill. Students cannot show up ready to learn if they're not emotionally supported in the classroom, whether that be a physical or most recently virtual space. According to the CDC, 1 in 5 children will experience a significant mental health challenge in their early years. Last year, while working on another bill regarding licensure for behavioral health providers, we identified a disparity in how we provide services in and out of an educational setting. As part of the blueprint for Maryland's future, this body saw fit to add additional funding for behavioral health and mental health services within the blueprint and to establish mental health coordinators recognizing the need. However, the guidance for health services, and in particular behavioral health services in an educational setting, are quite vague. And there are a wide variety of service providers who provide mental, emotional, and behavioral health services in our schools. So we need to take a holistic view of these services and how they are meeting the needs of our students. You will hear from providers as to some of the specific challenges in our current piecemeal approach, and you will see from the written testimony that services are provided by a broad community of school psychologists, social workers, school counselors, nonprofits, school nurses, school-based health centers, and others with a mix of certification requirements under the Maryland State Department of Education and licensure requirements under the Maryland Department of Health, creating a complicated landscape, service gaps, and a lack of common language from jurisdiction to jurisdiction. Within the existing certification guidance, the reference to mental health, for example, refers to psychological services, and the guidance says only that schools will provide psychological services as they relate to education. We want to ensure that behavioral health services provided to our students in Maryland are not only high quality, but equitable and consistent across schools and providers. But to do that, we need people with the right expertise helping to define and refine the landscape. HB 377 seeks to create a commission to evaluate the entire spectrum of care in an educational setting and evaluate, update, and make recommendations to the guidelines, including but not limited to mental health and behavioral health services, and will be staffed by the Behavioral Health Administration. The commission will report recommendations to the governor and the General Assembly by December 1st, 2021 and 2022. Last year, when we brought this bill forth, it was a forward-thinking bill to address the gaps in services and to create a more universal language and continuity of services across the entire educational spectrum. However, with the closure of school buildings, the transition to online learning, the added trauma of COVID, and anticipating the additional needs students will have coming back into the physical classrooms, we have a greater need for a commission with the right expertise to meet that need. Behavioral health is already a complicated landscape, addressing the immediate need for IEPs and 504s and the broader concerns of adverse childhood experiences and other challenges. And providers need a common language if they are to be effective as part of the administrative team and the greater school community. You will see the commission has broad support across the provider community, and Strong Schools Maryland identified HB 377 as a priority bill in complement of the essential work of the blueprint. In 2016, this body saw the value of bringing together experts in the field of education to make recommendations for Maryland's educational future. We need HB 377 and this commission to help educational support systems support that future with an integrated, equitable quality of care across our educational landscape, and to ensure we are using our dollars wisely and building a system of support. We need the right expertise addressing this issue and to meet this ever more urgent need. Thank you for your kind consideration. I'm going to turn the hearing over to Tina Dove from the Maryland State Educational Association, and I request a favorable report.
Okay, we will turn it over to the first person on the witness, and that is Ms. Dove, followed by Ms. Martin, followed by Ms. Gardner, and then followed by Ms. Frederick, and then Ms. Faulkner if she's with us.
Good afternoon, Chairman Pinsky, Madam Vice Chair Kagan, and members of the committee. As always, one of my favorite committees in which to find myself. Thank you to Delegate Bagnall for recognizing what I think so many of us have realized over the last year and beyond. And that is that many of our young people are undergoing a critical mental behavioral health crisis. And to be clear, that existed well before the COVID-19 pandemic happened. The pandemic clearly exacerbated that issue. I've testified a number of times in front of this committee about that. And the uprisings of 2020 have only lended to that. We're all traumatized. We are all suffering with PTSD. We all are struggling. And if the number of suicides that we've seen amongst our young people during this time is not enough of an indication of the dire emergency we're in, I'm not altogether sure what else exists. I wanted to share some numbers, sensitive to Senator Pinsky's desire to have us quickly wrap up so that you all can get to the other work you have to do. According to the enrollment numbers that MSDE put out from September 3rd, 2020, the state has 882,538 students in public schools. Servicing those students, we have 899.1 PPWs, pupil personnel workers, and social workers. That number is combined. We have 2,662 statewide guidance counselors servicing the whole entire state, all 882,000 students. In the psychological services department, we have 831.6 of them statewide that are helping our almost 883,000 students. Clearly, before the pandemic, the capacity to meet the mental and behavioral health needs of our students was not there, and that has been a long-standing issue of concern. That is only made worse by the conditions that we are currently in. It is absolutely essential that we address this issue now. It is something I have been talking to my colleagues and our members about for well over a year, and ringing the alarm about the PTSD that our students and staff will be returning to buildings carrying, and we do not have the capacity to address. I'm very excited to see that the House passed bill had language that was amended in to address the unique needs of our children of color. As a woman of color, I understand very, very specifically and in a very real way the challenges that face the members of my community as it relates to behavioral and mental health. And I'm excited to see that a focus is being placed on that. And it's also exciting to see Delegate Hamprey's bill and many others who've testified in front of this committee that have sought to address these concerns as well. The one thing that I think would help is to make sure that we have a current practicing certified educator on the commission. I believe right now more than ever, we're going to need to have someone who is on the front lines on a daily basis with our students, who can give dispatch to what they are seeing in classrooms and what the children and the staff in the buildings need. So hopefully we can, MSEA and the Baltimore Teachers Union would be happy to assist in that process.
Having someone
there, and the last thing I will say, other than asking for a favorable report, is that we need at this point to start rebuilding and strengthening school communities, and we need to start building up the people that are in them. This kind of an effort will help to make that happen.
Thank you, Ms. Dove.
For a favorable report. Thank you, Mr. Chair.
Gail Martin, ladies and gentlemen, please be brief. I'm gonna reduce the 2.5 minutes. It's very late, and it's very late in the session. Ms. Martin.
If I might, Ms. Martin had to jump off because she had a client.
Okay, Ms. Gardner. Ms. Frederick.
Hi, I'm here. Good afternoon, Mr. Chair and members of the Education, Health, and Environmental Affairs Committee. My name is Jennifer Frederick. I'm a student attorney with the Youth Education and Justice Clinic at the University of Maryland, Carey School of Law. I testify today in support of House Bill 377 as a representative of the Coalition to Reform School Discipline. Many of our children are struggling each day with issues impacting their mental health. A recent study found that from 2016 to 2019, children in Maryland ages 12 to 17 experienced a major depressive episode at annual rates that exceeded the national average. The mental health crises impacting children nationally has worsened over the last several years. The coalition testified in favor of this bill last year in light of the rising number of children with mental health needs. The call for a commission to study, analyze, and make recommendations regarding these needs was timely and necessary. However, as important as this bill was last year, it is even more important this year. The commission is particularly crucial now in light of the mental, emotional, and physical toll that the COVID-19 pandemic has exacted on Maryland's children. During the pandemic, the CDC has reported significant spikes in the mental health emergencies for children ages 5 to 17. Several other studies detailed the dramatic deterioration of children's mental health during the pandemic. Children are missing vital daily interactions that in-person school affords, and many children are lonely and isolated. Many have even withdrawn from school and their families. As a result, more and more children have mental health needs that are not being addressed. Most children who receive mental health services do so in their schools. This includes children who've experienced trauma. Without school, children have been left without these critical services. The commission would be well positioned to study and analyze the mental health needs of our children. In turn, professionals in our schools will be better able to treat these needs when children return to school. In the end, the commission's work would position students to thrive in school and beyond. Students who receive mental health supports perform better academically, and these supports also improve behavior and address trauma. For these reasons, as well as the additional reasons set forth in our written testimony, the coalition urges a favorable report. Thank you.
Okay, questions for any of the proponents? Questions? Questions, seeing no questions. I don't see Ms. Faulkner unless she's hiding, and I don't think so. Okay, that completes the hearing on Delegate Bagnall 377. Thank you all for your patience. Thank you all. Committee members, it is now 4:36. We'll meet in chambers at 10 of. And we'll probably have an abbreviated session. We're not going to work all night. We're adjourned.